Next would be the protozoan diseases of the cardiovascular and lymphatic system, which is the toxoplasmosis. Toxoplasmosis is caused by an infection with the protozoan species known as the Toxoplasma gondii. It is a protozoan species that causing the infection, and it is an obligate intracellular parasite. Now, Toxoplasma gondii has a worldwide contribution. Cats and livestock act as a host, and mice act as an intermediate host. Now, there are several different sources by which a person can be infected with this protozoan. One is through cat feces, so in this source or in this transmission, the person gets exposed to Toxoplasma oocysts. The second source is through undercooked meat, and in that source is the tissue cyst. There's also a horizontal transmission. This can include through organ transplant or blood transfusion from an infected person. In the fourth source is the vertical transmission from mother to child, and this leads to something known as the congenital toxoplasmosis. The hosts include cats and livestock, and human can be infected from cats through fecal oocysts, as well as can be infected from livestock through undercooked meat ingesting a tissue cyst. So again, the sources are cat feces with fecal oocysts and undercooked meat with tissue cyst. So when someone ingests either fecal oocysts and or tissue cyst, they transform into what is known as a tachyzoites. Shortly after ingestion, this tachyzoite then entered the muscle and neutral tissue of the individual and became a brachiozoite cyst. Now, what is most concerning is that in a pregnant woman who is exposed to cysts, these tachyzoites can pass through the placenta and infect developing fetus, leading to what we call congenital toxoplasmosis. So, what is the signs and symptoms of toxoplasmosis? We're gonna first talk about the congenital toxoplasmosis, and congenital toxoplasmosis has a classic triad of three signs and symptoms. And the first one is the chorioretinitis. The second one is the hydrocephalus. And the third one is the intracranial calcification. Congenital toxoplasmosis can also lead to microcephaly, and this is one of the infection that leads to an intrauterine growth restriction. Generally, during pregnancy, a woman who actually be infected with toxoplasma is the third trimester. However, can happen at any trimester, and being infected in the first trimester lead to worse outcome for the infant. Acquired toxoplasmosis is generally asymptomatic. It can be latent, so it can be basically be in a suppressed form and have no symptoms at all, but the person is still infected with toxoplasma. It can persist for the life of the person or individual, and generally, immunosuppression can lead to reactivation. So, when a person is severely immunosuppressed, as in AIDS, this can lead to in the reactivation of toxoplasma, leading to toxoplasmosis. And it can also lead to an acute systemic infection with acquired toxoplasmosis. There are a wide variety of signs and symptoms that we can see with an individual that is infected with toxoplasma. And one is, again, this is acute systemic infection. This acute systemic infection generally occur at 5 to 23 days after the infection. It can occur in immunocompetent individuals. Most of the time it is asymptomatic, but some individual can have symptoms. Those who develop symptoms have a benign and generally self-limited course that lasts for a few weeks to months. Cervical lymphadenopathy is the most common symptoms in acquired toxoplasmosis. It is a bilateral and symmetrical non-tender lymphadenopathy of the neck. This usually happens within weeks of infection. A subset of individuals, about 20 to 30%, will have generalized lymphadenopathy, and there can also be constitutional symptoms such as fever, chills, and sweats, and this usually occur for 2 to 3 days. Other symptoms of acquired toxoplasmosis can lead to headaches, myalgias, pharyngitis, and hepatosplenomegaly. It is the enlargement of the liver and spleen. And in rare cases of toxoplasmosis, it can lead to pneumonitis, myocarditis, the inflammation of the cardiac muscle, and pericarditis. It is the inflammation of the pericardium that surrounds the heart. It can also lead to polymyositis, hepatitis, and encephalitis or a posterior uveitis. And having said all of this again, majority of immunocompetent individuals are asymptomatic for toxoplasmosis. But in some individual, we can see some of these symptoms, and especially in those with a reactivation due to immunosuppression. So how toxoplasmosis is diagnosed? With CSF, we can do a right gym stain by staining the cerebrospinal fluid, and by serology or serologic testing looking for antibodies to Toxoplasma gondii. In serologic testing, typically a test that measures the immunoglobulin G, and it is used to determine if a person has been infected. It can also diagnose with the use of PCR, polymerase chain reaction, by looking for genetic evidence of Toxoplasma gondii. In immunocompromised patient, the patient we worry about the most for either symptomatic toxoplasmosis or a reactivation of toxoplasmosis, um, they can do or they can do a head CT scan and ophthalmological examinations. So how do we treat it? What do we use to treat toxoplasmosis? Again, because oftentimes this is a benign, self-limited infection, and a lot of times individuals are asymptomatic, they often do not require a treatment for toxoplasmosis. Most healthy people recover from toxoplasmosis without treatment. Persons who are ill can be treated with a combination of drugs such as pyrimethamine, sulfadiazine, plus efolinic acid. However, there are special considerations during pregnancy with the use of spiramycin and pyrimethamine and sulfadiazine. The mode of action of spiramycin definitively exert an inhibitory antitoxoplasmic effect, which clinically seems useful for preventing congenital toxoplasma infection during pregnancy or for reducing the inflammation in toxoplasmic chorioretinitis. The mode of action of pyrimethamine, it is to treat toxoplasmosis by inhibiting the T. gondii proliferation and survival through inhibiting the folate metabolic pathway. Lastly, the mode of action of sulfadiazine on a pregnant women is it is inhibiting the enzyme of dihydropteroate synthase. And for HIV patient, can use pyrimethamine. As I mentioned a while ago, the mode of action of pyrimethamine, it is to treat toxoplasmosis by inhibiting the T. gondii proliferation and survival through inhibiting the folate metabolic pathway. As well as in eye disease related to toxoplasmosis, it can use um, corticosteroids. It is to reduce the swelling in the eye or the inflammation in the eye.